Okay, good morning, everyone. I think we've got everybody on the line for today's special media briefing regarding the local opioid situation. And we're thrilled to have you all with us. Great to have awesome to have such a great turnout from our partners with the Peterborough Drug Strategy and our media guests. So we welcome you and thank you for joining us. Today's media briefing is one component of an enhanced opioid-related communications plan developed by the Peterborough Drug Strategy Partners in 2021 to foster greater understanding of the causes of the opioid crisis and evidence-based solutions needed to address it. We hope that these regular media briefings will become a trusted resource for substance-related information in our community. My name is Brittany Cadence, the Communications Manager at Peterborough Public Health, and it's my pleasure to be your moderator today. Just a few housekeeping notes that just ask that you stay on mute. And once we've heard from our speakers today, then I will open it up to media. I'll invite you individually to ask your questions. And if you can just indicate who you'd like to ask the question of, and they will respond. So we'll work through the media one at a time. And just to note, this media briefing is being recorded and it will be posted to the YouTube channel on Peterborough Public Health's YouTube page after this. So now I would like to introduce our next speaker, Emily Jones. Emily is the Community Engagement and Development Coordinator with the Peterborough Police Service, and she will lead us off with a land acknowledgement and a statement of respect. Please go ahead, Emily.
Thank you, Brittany. We respectfully acknowledge that we are convening today's press conference on the Treaty 20 Michi-Saagiig territory and the traditional territory of the Michi-Saagiig and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Skagag Island, Rama, Beausoleil, and Georgina Island First Nations. We respectfully acknowledge that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are grateful to have this opportunity to work on this land, offer self-reflection with a lens of reconciliation, recognizing that we have growth and learning to participate in while benefiting from this land. We are all treaty people. I will now make a statement in solidarity, a statement of respect. We stand in solidarity with people who use drugs in Peterborough and experience the risks of opioid poisoning. Over the past year, the drug-using community has experienced the dual impacts of the drug poisoning crisis and the COVID-19 pandemic with resilience. We hear the voices of people who use drugs, and we know that stigma drives the opioid crisis and prevents people from reaching out for the supports they need. We see the hurt and the fear that people are experiencing and expressing. We hear the voices of family members and friends who have lost loved ones forever and want to spare others from ever feeling similar pain. We all live here, and we encourage everyone in our community to view the complexities of addiction with compassion and understanding.
Thank you very much, Emily, for starting us off with those important words. So now it gives me great pleasure to introduce Jessica Penner. She's the coordinator with the Peterborough Drug Strategy, and Jennifer has some opening remarks to share with us today. Please go ahead, Jessica.
Thanks, Brittany. Good morning. Thank you for joining us today. Over the past year, Peterborough has witnessed the convergence of two public health emergencies, an experience that has been termed a crisis within a crisis. The opioid crisis predates COVID-19 by nearly a decade, but the pandemic has deepened and escalated its impacts. While data should be considered preliminary and subject to further verification, analysis from Peterborough City and County points to a worsening trend for both opioid-related emergency department visits and deaths over the course of 2020. COVID-19 has highlighted the importance of community-wide actions and behavior changes in reducing risks to ourselves and to public health. A similar community-wide response is needed urgently to address the escalating impacts of opioids as an intersecting challenge to public health and community well-being. To that end, today marks the first in a series of ongoing briefings to highlight the evolving situation surrounding opioids in Peterborough City and County. These briefings will provide an opportunity to share the most recent data, highlight current response efforts, and galvanize the broader community in a shared effort to reduce the harms associated with substance use. We are joined by representatives from the Peterborough AIDS Resource Network, 4 Counties Addiction Services Team, and Peterborough Police Service, which together with Peterborough Public Health and 10 other local agencies make up the Peterborough Drug Strategy. Over the past decade, opioids have been an enduring focus of the drug strategy's work, and PDS remains committed to actively working towards reducing the harms of substance use for individuals, families, and our community as a whole. Thank you again for joining this morning.
Thank you very much, Jessica. Okay, so now we will move on to our speakers, and very pleased to have with us today speakers who will share their updates and information regarding opioids in the community. We are going to start off with Dylan DeMarsh, the Education Coordinator of PARN. Following Dylan, Dr. Rosanna Salvatera, Medical Officer of Health from Peterborough Public Health, will share some statistics. And then following Dr. Salvatera, we'll hear from Jocelyn Qualtro, Health Promoter with Peterborough Public Health, who focuses on the Substance Use Prevention Program. So now I'm going to turn it over to Dylan, and he can give us an update from PARN. Please go ahead, Dylan.
Hi, everyone. Thank you for being here today. The partners who comprise the Peterborough Drug Strategy work together from their areas of expertise to reduce the harms associated with substance use in our community. This collaborative, all-hands-on-deck approach is necessary to meet the complex and varied demands of the drug poisoning crisis that we are currently experiencing in Peterborough. Much of this work, such as the application for a consumption treatment services site, is highly visible in our community, with regular updates provided to all who are interested in keeping up to date and learning more. Much of this work, however, is happening behind the scenes, such as PARN providing one-on-one services to people who use drugs, police and paramedics connecting people who've experienced overdose to the MSORT team, Peterborough Public Health leading the opioid early warning and surveillance system, Forecast connecting people who are ready to go to treatment and rehabilitation programs, and so much more. The purpose of these sessions is twofold. First, we want to share robust information about the response to the opioid crisis in our community by demystifying organizations such as the PDS, terms such as harm reduction, and successful practices that are in place, such as the Peterborough Opioid Early Warning and Surveillance System. We believe a well-informed public is crucial to ending this crisis, which touches on the second goal of these sessions, reducing and eliminating the stigma that we continue to see directed toward people who use drugs in our community. This stigma, manifesting in negative language and attitudes, drives people further underground at a time when it may be very crucial to ask for help. It devalues people's self-worth, builds barriers to treatment and other services, and divides our community into an us versus them dichotomy that does not reflect the complexities of addiction and drug poisoning. Thank you.
Thank you very much, Dylan. Okay, now we will have a review of current statistics related to the opioid crisis, and I would like to invite Dr. Salvatera to walk us through the next few slides. Please go ahead, Dr. Salvatera.
Thank you, Brittany. So today I will be providing some current data related to the local opioid situation. And this information comes from the fourth quarter status report into opioid harms that Peterborough Public Health released online a few weeks ago. It represents the data that we have for all of 2020. And in general, let me just begin by saying that 2020 revealed increases in our opioid-related harms locally, and we continue to be very concerned about the trends, and they are continuing into 2021 as well. So first, we'll look at the paramedic data, which you have before you in the slide. From October 1st to December 31st last year, we had 86 suspected opioid-related overdose calls that were received by the Peterborough Paramedic Services. And of those, 70% of the calls were from men, and 44% of the calls occurred between 4 p.m. and 12 a.m. So for reference, that's more than the 73 opioid-related calls received in the previous quarter. And it represents a doubling of calls that were received in the same quarter the previous year. Next slide, please. We'll look at hospital data next. And here we see data from PRHC, the Peterborough Regional Health Services Center, and from January 1st to December 31st in 2020, the preliminary crude rate of opioid-related emergency department visits for Peterborough was 151 per 100,000, which is twice the provincial rate of 81 per 100,000. And you can see that illustrated here in this slide. Next slide, I'll move on to first our confirmed deaths. So from January 1st to October 31st in 2020, we have annualized the rate of confirmed opioid-related deaths for Peterborough, and we have a rate of 27 per 100,000, which is compared to here to the provincial rate of 15 per 100,000. So just some technical remarks about how and why we did this. The 2020 rate of confirmed deaths is annualized because we have only 10 months of data available at this time. And that's because confirmed data on opioid-related deaths from the officer of the chief coroner is usually 3 to 4 months delayed. And we don't anticipate that we will have all of the 2020 data until April of this year. So what we did is we adjusted for the fact that we only had 10 months of data, and we annualized it so that it could be compared to the annual rates from other years. And here you can see this for you on this slide. And this is standard practice. Again, it just allows us to do this when we don't have a full year's data. And so this corresponds to 33 confirmed opioid related deaths for the year of 2020. And for reference, in the year previous to that, we had 29 confirmed opioid deaths. As of January 1st of this year, the number of suspected or unconfirmed drug-related deaths for Peterborough City and County is already at 39. Next slide, please. So let me talk a little bit about the unconfirmed deaths in 2021. Drilling down a little further, as of March 23rd, so at that date, the number of suspected or unconfirmed drug-related deaths for both the city and the county is 13. And this data will not be is not confirmed until we are able to get data from the Office of the Chief Coroner. So as we can see from these slides, the data is clearly indicating increases in paramedic calls for service, in emergency department visits, and in deaths in 2020 compared to 2019. And when we look further back, it shows a steady increase in the last 5 years in terms of emergency department visits and deaths. The rates in Peterborough for emergency department visits and deaths are almost 2 times higher than the rates of the province. Behind all of these statistics are real people. I hope this data helps to tell the story of what too many local residents are experiencing, and I hope it also conveys the urgency that is driving the Peterborough Drug Strategy partners in continuing to address this crisis together with and for the sake of our community. Thank you.
Thank you very much, Dr. Salvatierra. And now to give us an update on the Peterborough Opioid Early Warning and Surveillance System, I'd like to invite Jocelyn Qualtrough, our health promoter, to share a few words. And if you're able to put your camera on, Jocelyn, we'll spotlight you as well. Thank you.
Great. Thank you, everyone. So Peterborough Public Health led the development and implementation of the Peterborough Opioid Early Warning and Surveillance System in the summer and fall of 2018. The early warning system and surveillance system consists of an algorithm that measures the triggers associated with opioids and opioid-related harms. These triggers include, but are not limited to, opioid-related paramedic calls for service, emergency department visits due to suspected opioid overdose, anecdotal information from our local harm reduction agencies, and possible identification of a new and/or toxic substance. The early warning and surveillance system is monitored daily for triggers by Peterborough Opioid Early Warning Task Force. The task force ensures regular communication between core stakeholders from local agencies. So the agencies that make up this task force analyze those triggers on a daily and weekly basis and decide if and when alerts should be released to community partners and members of the public. Alerts remain in effect for as long as is needed. The task force connects regularly to reassess the local situation and determine the response that is needed. So whether or not an alert should be de-escalated, continue at the same rate, or escalate to include further measures. Members of this task force include Peterborough County City Paramedics, Peterborough Police Services, Peterborough Regional Health Center, Peterborough AIDS Resource Network, the Peterborough Drug Strategy, the Elizabeth Fry Society, Ontario Provincial Police, our local sector, Municipal Emergency Coordinators, Peterborough Fire Services, the new MSWORT project, the Mobile Support Overdose Response Team, and Peterborough Public Health. So an example of what this work may look like, a few weeks ago, we saw that Cobourg issued a news release stating that a substance called teal fentanyl had been found in the area. When the task force was discussing moving into the weekend and what to do with this information, Peterborough Police Services shared that they had indeed seized a substance called green fentanyl, and that this substance may be what Cobourg calls teal fentanyl. And this gave us the opportunity to ensure that poison prevention messaging was being shared before the weekend with a population who uses substances. So information like this is shared with us regularly. We talk amongst ourselves, and then we make sure to share that with our clients and with the public as needed. Thank you.
Thank you very much, Jocelyn, for that overview. Okay, so now we are going to turn it over to the media, and I will invite you individually to ask some questions. Thank you very much for being here. You are important partners in helping us convey accurate messaging to our population. And what I would like to do is, I've noted 4 media on the call. If I've missed you, please put up your hand when I'm finished going through the reporters that I see here. So we'll start today with Todd Van Donk from Peterborough This Week. And Todd, and for all of our reporters, if you can just indicate who you are targeting the question to. And we also have representatives from Forecast, Peterborough Police Service, so other partners are here as well. And if I could just ask our speakers to activate their camera if it's working, then we'll put you up on the screen. Okay, go ahead, Todd.
You put me on the spot there. I wasn't ready. Can you hear me all right?
Yep, you sound great.
Okay, thanks. I'm not sure who it's directed at, but can anybody offer some insight in regards to the demographic of the people this is affecting and where these overdoses are happening?
I can start, Todd. It's Dr. Salvatierra. When we looked at our data in 2020, what we saw was that 100% of these deaths were accidental, and that almost 94% of them occurred among people aged 25 to 64 years of old. So that gives you the age group, and I'm wondering if other speakers can add to help answer Todd's question.
Are there other partners with more to add? Okay.
It's Donna. It's Donna from Forecast. I can also weigh in. Certainly, I would echo what Dr. Salvatierra is saying, is that obviously an age group between 25 and 64 is a large demographic and fairly non-specific in terms of which are we targeting or are we seeing clusters. And I think that that's one of the unique experiences that I think that we have, is that this group is from 25 to 65 in age. So it's tough to hone in on a specific age demographic. I think one of the slides that Dr. Salvatierra showed, around 70% of them are of the calls to Peterborough paramedics are men. And I'm not sure if that holds true in terms of the deaths are 70% men as well. But certainly I would just echo that it is a very diverse demographic age-wise.
Just following up on that, in speaking with some people, it's my understanding that the crisis is starting to really hit young, vulnerable women. Is there any truth to that, or are you seeing trends in that where it's really starting to impact young, vulnerable women? For anybody? Questions for anybody, really?
I wonder if that's a question for one of our health promoters, or?
Yeah, hi, Jocelyn here. So that may be the case in what we're hearing, but we won't be able to tell for sure until we do have confirmed data. And again, that data we won't have it, and we won't be able to release it until 3 or 4 months down the line. So it's hard to tell right now.
Sorry, at the start of that, did you say you are hearing that?
No, I meant that might be what people in the community are hearing. I haven't heard that much. Be able to confirm or even look into that until we have data.
Thank you so much.
Thank you.
Okay, great. Thank you, Todd. So let's move on to Will Pearson, who's joining us from Peterborough Currents. And Will, if you've got some questions for one of our speakers, please go ahead.
Yeah, I think this would probably be for someone from Peterborough Public Health, and just anyone with like sort of one-on-one relationships with drug users that can speak anecdotally about who, like the shortcomings of this data, and who, if there's anyone that, or any groups that maybe don't get captured. I'm thinking, for example, of people that might overdose and self-resolve and not go to the hospital. Yeah, and if there's any sense of who this data might not be capturing.
Right. I wonder if that's a question about the limitations of the data.
Sure, yeah.
Would that be something, Dr. Salvatierra, you could comment on?
Well, I'm not front line, but I would agree with you in that when we report emergency department visits, people have to get to the hospital. And when we report paramedic calls, people need to call 911. And we're only counting deaths. So you're right. There is probably a bit of an iceberg out there, and we're just seeing the tip of that iceberg. I think some of our agencies like PARN and Forecast and MSORT would have a better sense of what is out there that we're not able to capture. So I'm wondering if any of the other speakers might be able to respond as well.
I can respond to some of that. I don't have an exact answer, but what I can tell you is that through the evaluation, I think Jess Penner can also speak to this as she's doing a lot of the evaluation, is that we are trying to capture some of that data through our referrals with MSORT of people who aren't going to the hospital. So these are people that are overdosing, and maybe police are interacting with them, or EMS are interacting with them, and they're not going to the hospital. So that's kind of the population that MSORT is trying to get connected with. And so although we don't have the data right now, that is something that we're actively working towards.
Thank you, Emily. Are there any other partners? Donna Rogers, did you have something to add?
I would say that one of the things that is possibly we don't comment on enough is the success that we are having in getting naloxone to our community. So I do believe that we have very high rates of naloxone distribution. I do think that most of us have, as partners, have very much embraced naloxone as a life-saving harm reduction strategy. And I think that there's certainly data. I know that there's data through the health unit in terms of the rates of distribution of naloxone, and I don't know if we're higher than other areas. And it's one of those things that we can track how much we're distributing, but we can't track how often it is being used, or if it's being used, how often we're reversing the effects of a opiate poisoning related to that. But I do think that as a community, we have embraced very successfully distribution channels for naloxone.
Thank you, Donna. Any other questions, Will?
Yeah, I guess. Oh, yes, I am still on. I guess I would be interested, and I don't know who this is for, but to learn a little bit more about some of the drivers of the increased death rates. Like, is it the drugs becoming more dangerous? Are more people using drugs? Is stigma increasing? Why might we be seeing such an increase in deaths and overdoses in our community?
I wonder, Dylan, would you have some thoughts on this to share? Or Emily?
I can speak to this. So again, like, this is not going to be anything based in data. This is just stuff that we know anecdotally, and that we know that stigma is always going to be a driver. So language, the way that language is used, the way that people who have addictions are talked about, the way that we talk about these health crises influences whether people feel comfortable to talk about it in public or talk about it to health professionals. So that will drive isolation, and isolation will drive overdose. So that's, of course, always going to be a factor. I think the main factor that's happening, though, is that we do have a poison drug supply. So we have people who are using drugs who don't know what's in their drugs. They don't know what they're using, and so they're not intending to overdose, of course, right? These are accidental overdoses. And so with those contributing factors, more people are using alone because they're feeling isolated, because they're feeling stigmatized, kind of married together with the fact that there's a poison drug supply is a pretty dangerous combination.
Sorry, I had my microphone muted.
That's okay. Go ahead, Dylan.
I just wanted to add in and follow up with Emily's piece that we do believe that isolation is having an impact. And right now we're strongly encouraging people who come through Parents Harm Reduction Program to access the National Overdose Response Service. So that is a confidential, non-judgmental support for people who are using drugs. They will stay on the phone with you while you're using. That phone number is 1-888-688-6677. That's 1-888-688-6677, or those last four digits spell NORS. Thank you.
Thank you very much, Dylan. Will, any further questions?
I would love to follow up on what Emily was saying about just the poisoned drug supply, and I wonder if anyone is able to give an update on any local efforts to establish a safe supply pilot project in Peterborough. I know some other communities in Canada have been successful getting those pilots up and running, and I feel like if Peterborough's numbers are so much higher and so much more concerning than the rest of the province, I feel like we'd be a good community to get something like that off the ground, and I'm wondering if that's being pursued.
Okay, who would like to speak to safe drug supply?
I can take that again if.
Go right ahead.
Okay. So yeah, we do know that the supply is toxic and has been a contributing factor in the rising numbers of deaths. And it does necessitate an urgent expansion of a range of harm reduction services, including safe supply programs. So one of the things to remember is that each harm reduction program, so whether it be needle exchange, whether it be a safe injection site or a CTS, or whether it be naloxone, are all just pieces of a puzzle, and that includes safe supply. And so yes, this needs to be talked about, and yes, I think there's support in this community, but we all need to remember that each one of those alone is not going to conquer this problem. This is a pieces of a large puzzle, and so safe supply is a great harm reduction tool. And so is a CTS. They're great harm reduction tools, but they all need to work together. And so that's just really something that I like to highlight, is that we have all these great tools, and until they're all working together, if we're only doing one-offs at a time, it's not quite going to be the entire puzzle. And that's including, of course, treatment, and that's including life-saving medication, and that's including a safe supply. So local efforts are underway to explore the barriers and enabling factors to support safe supply and prescribing models that are suited to small, rural, and urban areas. The findings of an upcoming research project on this topic, it can help promote the development of a safe supply model in the area in the future. And I think there's lots of support, and there's been lots of dialogue around that.
Great, thank you. Any further questions, Will?
I have one last one, and I think it would be for Donna Rogers, since Forecast is leading this application now. I think that a lot of people in the community are curious about the status of the CTS application. I would be curious to learn whether you've heard anything back from the federal government on the application for the exemption, and then the provincial government on the application for funding.
Thanks, Will. We have all of our documents submitted, and both federal and provincial are in their processes of review. And what I will say is that they are very comprehensive processes. So they are having regular communications with us to seek different information or clarification or assurances. But we continue to await a favorable reply.
Great, thanks a lot, everyone.
Great, thank you very much, Will. Okay, let's move on to Jessica Nisnik from Global. And if you've got some questions for our speakers, if you could just let us know who you'd like to ask, please go ahead.
Thanks, Brittany. I guess this might be for Dylan. Dylan, is the Harm Reduction Center, has it moved into the Greyhound building yet? Is it all settled in there?
Yes, we are currently offering our harm reduction services out of the old Greyhound building on Simcoe Street.
Perfect, thanks. And I think I just had to answer an email. Did you just, sorry, not necessarily for you, Dylan. Was there just an update on where we're at with CTS that I may have missed?
That was just provided by Donna Rogers. I'll let her.
Perfect, that's fine. Donna, I recorded it, it's okay, so I've got it. And just lastly, on Todd's question, we didn't get the where. So where these overdoses or deaths are happening. I think that's important because of the stigma that goes along with it. So if anyone's able to shed some light on, where these tragedies might be happening, that would be helpful.
I wonder, Emily, would you have some thoughts on where?
I can answer a little bit of that.
Yeah, go ahead, Jocelyn. It would probably make more sense.
Thank you. So currently we don't look at any geospatial data or geographical data. That is something we are currently doing an evaluation of our early warning and surveillance system to change our processes, make it work a little bit better for ourselves and our partners. And looking at geographical data may be one of those components that we consider further down the line. The only issue with that is being able to possibly identify individuals. So again, we come down to that issue of privacy. So, I mean, we're looking at it, but I can't guarantee whether or not we will be including that. And that's just on terms of data and looking at the early warning surveillance system. I'm not sure if any of the other partners have anecdotal information that they're able or willing to provide.
I will say this, I can't remember when it was, maybe 2 years ago, there was an opioid crisis seminar at the Lakefield Outreach Center, and they did have that data. They had how many, I wasn't sure where it came from, that's why I'm asking. They had how many were in the county, how many were in the city, and the proportion that were happening in homes. So I know that data was once available. I don't know if it was the paramedics or who gathered it. Do we know?
Jessica, it's Donna from Forecast. I will say that I believe that did come from paramedics, and I think that they did some geographic analysis of calls that they were attending. I don't know that it included here's where the deaths were and the calls, or just calls for service. But I agree. I do remember having seen that data, and I don't know if the county produces those sorts of, or if the paramedics produce those sorts of reports regularly, but I agree. I did see that a couple of years ago, and I do know it was the paramedics.
Okay, perfect. Thanks, Donna. Maybe I'll reach out to them and hopefully I can get a little more info on that. That's it for me. Thank you, everyone, for your time and for holding this today.
Thank you very much, Jessica. I see a question from Todd, so we'll give you a chance, Todd, and then we'll move on to Matthew Barker. So go ahead, Todd.
Yeah, no problem. I was just going to clarify that those stats do come from Craig Jones from EMS. I was just offering that. That's all.
Thanks, Todd.
Yeah, no worries.
Thank you, Todd. Great. Okay, Matthew from the Examiner, if you've got some questions for our speakers, please go right ahead.
Yeah. I guess this one would be for Dylan DeMarsh. What measures are being taken now? And sorry, my apologies. I was kind of late, so I might have missed this if it was already covered. What kind of measures are being taken to educate people with regards to use and I guess safe use?
So our harm reduction workers at PARN do one-on-one interactions with people every day, and those are opportunities for us to let folks know about spikes in what we're seeing in the community, if there's been an increase in drug poisonings or overdoses. So we're able to share that information directly with people who are accessing the service. We're providing basically a lot of health and social service referrals to folks as well when they come through. So, people have a lot of questions about their health. We're able to connect them out. Matt, I gave out the NORS hotline number earlier in the conference because that's a piece that we're really heavily sharing with folks when they come through right now is recognizing that there are higher possibilities of using alone right now, and we're really trying to make sure folks aren't using alone. That's the key risk right now.
Okay. All right. Second question. I guess anyone can answer this one. So I'm kind of hearing that with regards to naloxone and the drugs that are mixed with fentanyl, there is an impact that it's not working as well. Now, can anyone answer or explain that for me?
I can speak to a bit of it. We've seen and heard evidence of benzos being mixed into the drug supply, and that is requiring at times more than one naloxone. We're hearing anecdotally folks having to use more than one hit of naloxone to awaken somebody. So that would be an example of the kind of information that we are sharing with folks through the harm reduction program at PARN.
All right, awesome, thank you.
And if I could just add, this is Evan Brockist. I'm a health promoter with Peterborough Public Health as well, is that what we know obviously is naloxone is only effective for opioids. So that's why it really underscores the critical importance of always calling 911 if there are symptoms of overdose, because that will allow the provision of follow-up care and transport to the hospital so that medical support can be provided in the instance that it happens.
I'm also not sure if the police can verify in drugs that are seized if they're seeing benzodiazepines with mixed into some of the opiate supply.
Would one of our police partners be able to answer that?
Certainly, it's Inspector Jamie Hartner with the Peterborough Police. At this point, we haven't had that information yet, but saying that it does take a lot of time. We have to take it to get it analyzed, and it typically the results come back 3 to 6 months. So unfortunately, we don't get that information in a timely fashion.
Okay, thank you. Any more questions, Matthew?
No, thank you.
Okay, and if there's no other media questions, I don't see any hands up. I think we've been able to get through everyone today. And so we do want to thank you all for joining us. Hope you are finding this helpful and full of information to share with our community. Please stay tuned for our next briefing. We will send out a media advisory when that is planned to happen. And to access the statistics that were shared by Dr. Salvatierra, you can find this on the Peterborough Public Health website under the reports and data section. And there's a report called the Opioid Status Report for 2020, so you can access the information there. So again, thank you all. Thank you to our partners, and we will be in touch with our next briefing information coming up soon. Thanks. Take care.
Thank you.
Thank you, everyone.